Podcast. Great. Listen, good morning to any of those of you that are calling in from Europe. Good afternoon to anybody calling in east of Dubai. My name is Joshua Brown with the World Economic Forum, and I'll be your moderator and facilitator for today. I'm joined by four M2030 private sector champions who will be sharing some of their views today on the fight to eradicate malaria in Asia Pacific. We'll hear directly from those leaders in their fields, but we'll also about malaria, but we'll also hear from them about what it means to be running a significant organization and dealing with a public health crisis in the middle of a global pandemic. We'll hear from the Tahir Foundation, Jonathan Tahir, or possibly his colleague and chief executive of the foundation, Juliana. We will hear from Melvin Pun, who is the CEO of Yoma Strategic, one of the most foremost organizations in Myanmar. We'll hear from Win Win Tint, who is the chief executive founder of City Mart Holdings Limited, the largest grocery retailer in Myanmar. We will hear from Dr. Wit Sun Tarnun, the director of the Danin Tawi Shrevenant Foundation. And in addition to these M2030 champions, we'll hear from leadership and those who have deep subject matter expertise from the Asia Pacific Leaders Malaria Alliance. We'll hear from the Bill and Melinda Gates Foundation, and we'll hear as well by video from Peter Sands at the Global Fund. We have quite a significant and packed hour ahead of us, and I want to jump in as quickly as possible. But before we do, just wanted, as a matter of housekeeping, to remind you to use the chat function, the Q&A function rather, to jump in and ask questions that you may have. We'll reserve some time towards the end of our session to actually get some of those questions answered by members of our distinguished panel. But I'd also remind you to think about upvoting questions that you see appear in the Q&A function. And you'll find that by clicking on the small heart icon, you can sort of like a particular question to move it up and give it a little bit extra attention to those who will be picking from a long list of questions towards the end of our session. Without further ado, let me turn to Ruby Shang. Ruby is a member of the board at the Asia Pacific Leaders Malaria Alliance. She's also on the board of M2030, and Ruby's going to kick us off with some opening remarks. Over to you, Ruby.
Thank you, Joshua. I'd like to thank the World Economic Forum for co-organizing this event together with APLMA, the Asia Pacific Leaders Malaria Alliance, and M2030. This is a very timely event, considering leadership in the fight against both malaria and COVID-19. Each one of us is responding to the pandemic in our own way. I've changed my life. I know that you've changed yours. We're following on a daily basis data for our country, our region, our cities. We're dismayed by the lack of leadership in some countries, I won't mention which ones, and admire others' ability to keep the virus at bay. We know that single-handedly, the epidemic is devastating economies, livelihoods, and communities. What we may not realize is that it's also disrupting health services and supply chains required to fight and control other diseases. The WHO is estimating that the pandemic may lead to a doubling of malaria deaths in Africa. It means malaria would kill a person, mostly children and pregnant women, every minute around the clock, claiming an estimated 800,000 lives. The coronavirus is the world's youngest and newest disease, while malaria is our oldest. It's been around for at least 60,000 years. And for the first time, we can see the end of malaria in Asia, which is why everyone has been working so hard. Just in the last 8 years, malaria cases in Asia have dropped by 50% and mortality rates by 80%. And this is unprecedented. This means we have better trained healthcare workers and more efficient health systems in place to identify and treat malaria. We need to gather the momentum which is in place. We can't be complacent. Just as we've seen in other older diseases and in the COVID pandemic, we can't let our guard down. We need to end malaria now. Never before have we been this close, and never before have the stakes been higher. And this is why the Asia Pacific Leaders Malaria Alliance, or APLMA, came into existence. In 2014, 18 heads of state at the East Asia Summit committed to end malaria in the Asia Pacific by 2030. Subsequently, 5 more heads of state joined, and so we now have a total of 23 heads of state who have made the commitment. But as you know, government cannot do this alone. We need private sector leadership. And so this is why APLMA created M2030 under Patrick Silborn's capable and entrepreneurial management. He created a platform with the business leaders represented today: Jonathan, Win-Win, Melvin, and Dr. Witt. They are our champions. Thank you to each and every one of you for defining leadership in your own way in Asia and being part of M2030. Thank you.
Brilliant. Thank you, Ruby. That's really helpful framing. I think we all really appreciate your remarks on that. And that's a great start to our session. Maybe just to sort of get a temperature on the topic, we can go to a quick poll. And Sonia, if you could launch that poll from us. The question we're asking here is, if you could choose only one, which is the most impactful way for M2030 business to engage in malaria elimination? And I think we've reversed the order on some of these questions a little bit here. We'll come back with some others, but just want to get a quick, maybe a quick read since we've got this question up here. Get a quick read from the group, and we'll give it a few more seconds here. If you haven't voted here, please do. It's interesting. There is an emerging leader, but indeed it's quite consistently spread, quite a nominal distribution. So let's just give this a few more seconds here. Great, Sonia, and if you could end the polling, share it with our audience, we can have a look at what seems to be emerging. So there is a clear winner here: CEOs who can advocate for sustained political will and public funding for malaria. So surely for the M2030 group, that's very much validating. Thanks, Sonia. As our sort of next action here, we're going to go to a video message from the Bill and Melinda Gates Foundation. Unfortunately, Jennifer Gardy, who is the Deputy Director for Surveillance, Data, and Epidemiology, couldn't be with us today, given that it's about 3 o'clock in the morning in the U.S. But we've gone to, she's been kind enough to provide us with a video message. Sonia, could you pull that up for us and share Jennifer's video message with us?
Hi, everyone. I'm Dr. Jennifer Gardy, Deputy Director for Surveillance, Data, and Epidemiology on the malaria team at the Bill and Melinda Gates Foundation, and it is a pleasure and a privilege to share some of my thoughts with you at this virtual gathering. Time zones, of course, preclude me from joining you live in person, but I do hope that these recorded remarks leave you with an important message, namely that now is the time to preserve and strengthen essential malaria services, and that success in eliminating malaria in Asia is a vital and catalytic step on our journey to eradicating malaria worldwide. Now, there's no doubt that the COVID-19 pandemic is currently the top global health priority for countries around the world, but at the same time, we need to maintain our commitment to fighting diseases that claim hundreds of thousands of lives each year, diseases like malaria. Our gains in malaria have been precious, but those gains are also precarious. The slightest lapse in our resolve, the smallest stutter in our response, could reverse decades of hard-won progress. Worldwide, health systems truly are struggling to cope with the added burden of COVID-19, and while each and every country faces unique challenges in responding to this crisis, malaria-endemic countries, particularly those in sub-Saharan Africa, are in an especially dangerous situation. Past health emergencies have shown that when already fragile health systems are disrupted, endemic diseases will surge. During and after the 2014 Ebola outbreak in West Africa, for example, malaria, TB, and HIV/AIDS ultimately contributed to many more deaths than the Ebola virus itself. We fear the same situation may be unfolding now in the case of COVID-19, only this time over a much larger scale. In countries where health systems lack resources and are already overburdened responding to other infectious threats, disruptions to health services and campaigns will have devastating effects. A recent modeling analysis from the World Health Organization and partners found that if essential malaria prevention and treatment services are severely disrupted by the COVID-19 pandemic, things like bed net distribution and access to anti-malarials, malaria deaths in sub-Saharan Africa could double compared to 2018, a return to mortality levels that we haven't seen for 2 decades. The good news is that countries, multilateral agencies, and partners have taken action to avoid the worst outcomes predicted by the models by prioritizing net distribution campaigns, IRS spraying, and clarifying treatment-seeking guidance, particularly in high transmission regions. We are on a trajectory that will avert that major step backwards in progress. But just as COVID-19 will continue for the foreseeable future, so too do these actions need to continue. We, as the global malaria community, must stand together to ensure that essential services and commodities are available to all who need them during the pandemic. This is a global story, but this is also an Asian story. Reducing the burden of malaria across Asia is critical to maintaining global progress against this disease, and although Asian countries have been doing an exceptional job of managing the COVID-19 pandemic, it is imperative that you remain vigilant against the threat of the virus and its potential to jeopardize your region's progress in fighting malaria. Robust political will and widespread uptake of bed nets, anti-malarial medicines, and rapid diagnostic tests have helped to cut deaths from malaria by more than half since the year 2000. The committed leadership of countries in Asia has been central to this progress, which is truly one of public health's greatest success stories. In 2018, China and Malaysia reported 0 indigenous cases of malaria, putting elimination within reach. But if COVID-19 disrupts the essential malaria services that have made this possible, these historic gains could be undone. The Greater Mekong subregion has long been on the front lines of the fight against emerging drug resistance, but without urgent action, COVID-19 threatens to disrupt vital projects focused on monitoring and responding to resistance. Without this work, multi-drug malaria could spread, costing lives and resulting in lost ground in this global fight. The COVID-19 pandemic underscores why eliminating malaria is so essential. The world's poorest and most vulnerable communities face a double burden with the combined impact of endemic diseases like malaria and emergent threats like COVID-19 stretching health systems to their limits. And even in countries with relatively small malaria case counts, the disease will always have the potential to resurge in times of crisis like the pandemic facing us now. History has shown that we can't be complacent when it comes to infectious diseases. With each advance we've made against malaria, the parasites and the vectors fight back, evolving resistance to our most effective drugs and insecticides, rendering cutting-edge tools ineffective, requiring further investment, and ultimately resulting in more lives lost. That is why we can't be satisfied until the job is done. We need to stay focused on elimination, and Asia can lead the way. Ridding the world of preventable, treatable diseases like malaria will lead to healthier, more prosperous communities that are better positioned to confront new health challenges like COVID-19 as they arise. Thanks to impactful partnerships and initiatives like M2030 and the contributions of partners and individuals from every sector, we are one step closer to a malaria-free world. The fight against malaria is too big and too complex for any one organization, sector, or field to solve, particularly in the face of new challenges like COVID-19. Eradicating malaria for good will require investment and input from individuals and organizations at every level, and they can't go it alone. Partnerships are critical because they enable every organization to contribute the resources necessary to fill financial and technical gaps and to position countries to make that oh so important final push towards elimination and ultimately a world free of malaria. Thank you.
Really valuable perspectives there, I think, from Jennifer on the global effort on malaria. Ruby mentioned Patrick in her opening remarks, and for those of you who don't know Patrick, he is an absolute driving force behind the M2030 effort. Patrick, you are the head of external relationships and financing at M2030, but I know you do much, much more. Just for those of us who are maybe a little bit less familiar with M2030, could you frame it for us? Tell us a little bit about the organization, its effort, its mandate.
Absolutely. Thank you, Josh. Well, M2030 is a partnership that brings together businesses and consumers to help end malaria in the greater Mekong sub-region and in Indonesia. And since we launched in 2018, we've been fortunate to partner with some of the best and most far-reaching businesses and foundations in the region. Our partners use the M2030 brand for consumer-facing campaigns to raise both awareness and funds for malaria programs in their countries. And since the onset of COVID-19, the M2030 partners have also contributed other resources to assist with relief and recovery efforts. These campaigns and assistance are incredibly helpful, but M2030 is also very much about leadership. And this is perhaps the most different and prominent aspect of this initiative. So it was interesting to see the result of that poll question. So M2030 leaders utilize their reach to help keep malaria elimination a political and funding priority. Last year, we launched the M2030 Champions Council together with the World Economic Forum. And the council consists of prominent business leaders. Many of them are here today. Melvin, Jonathan, Juliana, Win-Win, and Dr. Witt. And it also includes Ray Nishimoto, Dick Van Motman, and global health leaders like Peter Sands from the Global Fund and Christoph Ben from the Joop Lange Institute. And by engaging in the public discourse and with the media, our champions help keep malaria in the spotlight. And that's important, probably more so now than ever. So it's not lost on anyone that we're facing one of the biggest crises of our generation. But as Jennifer mentioned just a minute ago, if we take our eyes off malaria, it will bounce back and the impact will be enormous. So we must do both. And we need to continue strengthening systems that can pick up and treat any disease, regardless if it's malaria, COVID, or any other ailment. So I'll end here, Josh, just by again acknowledging the dedication, the resources, and the leadership by M2030 partners. They really play a critical role in this journey towards elimination of malaria in Asia, and we couldn't do it without them. So we'll end here with showing a short video that describes the the mechanics behind M2030. Sonia, so feel free to play the video.
Malaria has caused more death than any other disease in history. Today, malaria still kills one child every 2 minutes. Imagine you have the power to change that. It is possible to eliminate malaria in Asia by 2030. We are almost there, but we need your help. With simple everyday choices like shopping online, using your bank card or drinking your favorite coffee, you can make a difference. Look for the M2030 brand and choose products and services that have joined the movement to eliminate malaria from Asia. Your choices can save millions of lives. Imagine that. You can be part of history in the making. With M2030, we are defeating malaria together.
Brilliant. So important role for chief executives, for corporate leaders, but also for every consumer. Let's turn now to some of our M2030 champions. Juliana, I'm going to start with you. Juliana, you are the Chief Executive Officer at the Tahir Foundation, which is one of the foremost philanthropic organizations in Indonesia. And that organization has a long history, in fact, of contributing to global health programs in partnership with both the Bill and Melinda Gates Foundation and also with the Global Fund, both of whom we'll hear from today. What do you think makes public health such an important issue for the family personally, and why is it so important to the core mandate of your organization?
Okay, thank you, Joshua, for the time. And first of all, on behalf of Mr. Jonathan Tahir, I'm Juliana, representing Tahir Foundation in this meeting. He apologized for not being able to join this meeting due to urgent matters. And by giving this opportunity with Tahir Foundation, thank you. And then our vision at Tahir Foundation is to help to provide better access to healthcare and education that enhance people's quality of life. We realize that both healthcare and education are the key pillars for a nation to face future challenges. Many developing countries are still far behind the ideal condition to provide that access. In terms of healthcare, we can see now during the COVID-19 pandemic how important it is to not only have access to good healthcare system, but also a good management of the healthcare system itself. We can relate education in this situation too, as we can see how important it is to educate people, for example, like to wear masks, to wash hands, and to keep a social distance. Malaria is still a big problem globally. However, we see the light at the end of the tunnel as cases of death due to malaria from 2007 to 2017 have decreased by 50% and 66% respectively. As of April 2019, nearly 55% of a district were malaria-free, and 76% of population live in malaria-free area. This shows that past efforts have shown promising results, and we must eradicate it completely, which I believe we can. Our partnership with Bill and Melinda Gates Foundation and the Global Fund was started in 2014. This partnership helped us identify key strategic issues and get access to the most advanced research and best practices, as they have a good system to accomplish the goals. We will try to emulate that system locally when aiding our community here in Indonesia. As a member of the business community, we are honored to work together with the civil society and the government to improve healthcare in particular, because of this is not only government responsibility, but ours too from the private sector. By working together with the government, we believe our target can be achieved better and faster. And we have seen firsthand where the private sector stepped up in the fight against COVID during the last few months. We also encourage more businesses in the private sector to contribute and get involved more actively, not only locally, but also globally if possible. Thank you.
Thanks, Juliana. And Melvin, I'm going to go to you in a minute. You also you run a very prominent multi-generational family business. Before we get to that, I think we've got a video from Yoma. Maybe we can turn to that, Sonia.
Yoma Strategic Holdings is one of the most innovative conglomerates in Myanmar. It is committed to drive positive change in the communities where it operates. Yoma Strategic is one of M2030's founding partners. Since 2018, it has rolled out campaigns and fundraising activities across its portfolio. By engaging brands as diverse as New Holland dealerships, Wave Money, and PHS hospitals, to popular food and beverage outlets like KFC, Auntie Anne's, and Little Sheep Hot Pot, Yoma Strategic is showing the way. M2030 campaigns have engaged consumers as agents of change to raise both funds and awareness to end malaria.
ဒီပညာပေးအနေဖြင့်ဒီကျမတို့ဆက်တွေပေါ်မှာ M2030 sticker တွေကိုကတ်ထားပေးပြီးတော့မှလက်ကမ်းစုံဆောင်များကိုလည်းပေးဝေပြီးတော့မှ customer များကိုမျှဝေပေးပါတယ်ရှင်
Today, business leadership is more relevant than ever. We know that to defeat COVID-19, governments, businesses, and consumers must work together. The same holds true for malaria. M2030 and Yoma Strategic Holdings defeating malaria together.
Melvin, as I sort of alluded to here, you sit at the helm of this very diversified conglomerated business with a lot of consumer-facing businesses. That business has been now a pioneer partner of M2030 since 2018. Now, I think probably like all of us, you are at the moment wrapped up and focused very much on responding to this, very challenging COVID-19 pandemic. But I'd love to hear from you. What do you think is the role of business in responding to this pandemic, but also what's the role of business in responding to public health questions more broadly?
Well, thank you, Joshua. A couple of years ago, we had the privilege of being part of the founding of M2030, and we started with some, I guess, vague philosophy or understanding that we're almost there at eliminating malaria, and there's a strong need for private sector to really support the public sector to really get to the finishing line, particularly as with any disease that is becoming less of an impact in the world. There's kind of the pressure is off, and we think that's actually quite dangerous for the pressure to be off and there not to be awareness. So from that overall vague notion, we wanted to play more of a role in awareness building. But it wasn't really until COVID that it really hits home in terms of businesses' role in the community, particularly on public health. I think all of us are going through this period and in a self-discovering mode. And what COVID has really taught us is our responsibility is not really just making money. In fact, it may not be mainly about making money. There's such an important role that business plays in contributing to the society. I think it's particularly more relevant for developing countries like Myanmar, where there's so much to do across the board, and business have a disproportionate role in driving various initiatives and driving business practices. But as we navigate COVID and we look at what the risks are to the business and what we can do, it's also very clear that our responsibility and our impact cannot just be the people who we're directly interacting with. It's not our staff, it's not our customers, it's not even other stakeholders like shareholders. But it has to be much broader. The local communities that we serve, the wider community who may be impacted. So we started thinking quite deeply about kind of what we can do for those broader communities, and it's not just kind of a nice thing to do. It's actually essential because if we can't positively impact them, then it will only come back to hurt us. Yeah. So as we look at that, we really took some of the playbook from M2030 and also our fight against malaria, and used it for COVID. One of the biggest things is really awareness building. At the beginning of the crisis, I remember we were starting to do a lot of kind of temperature checks and travel restrictions as early as January, when we were hearing about the potential for a pandemic. But I have to say that the local communities were quite lax and not really aware. So the initial phase of awareness building and really just educating people, I think, was very essential. So communication, awareness building, education. And then as the pandemic becomes more and more serious, I think we also thought that there was a role that we had to play in terms of providing certain level of social safety net. Of course, there's only so much that the private sector can do, and it has to be in support of the government. But what we are realizing is, as the economy gets shut down, people are, of course, worried about their job, worried about finances. So we did what we can do as much as possible. Our bank provided, loan relief, repayment holidays. We provided emergency loans to our staff. We actually took a collective effort at the senior level to take a sizable pay cut, but also guaranteed our lower level staff to make sure that they have job security. And we also communicated a lot of these actions to our partners and other companies, because we think that together, this has to be tackled. So I think, overall, there's actually, interestingly, quite a lot of parallels as we look at how we can play a role in a company, in the community, a parallel between our fight in malaria and our fight against COVID. At the end of the day, what it has really shown us is this world is extremely connected, and there is a very big role that corporates can play. And even though our impacts individually will be limited, I think together it makes a lot of difference.
Thanks, Melvin. Always interesting and inspiring. I note that there are some questions coming in the chat function. I would just remind those that are dialed in today, if you've got questions, please do share them with us in the Q&A function, not the chat function, but in the Q&A function, and we'll come to those towards the end. Sonia, I know we've got Peter Sands by video. Peter Sands is the Executive Director of the Global Fund. Can we go to his clip? Can we roll that film, please, Sonia?
Thank you to all of you, the M2030 champions, for your commitment, your energy, your leadership in fighting malaria. We face a huge challenge right now because of COVID-19. COVID-19 not only threatens to cause death and suffering to many of the poorest and most vulnerable people in the world, but it also will disrupt and have a knock-on impact on our efforts to counter other diseases, including malaria. Analysis from the WHO suggests that we could see malaria deaths double over the next 12 months due to the disruption to vector control, to test and treat, to case management. Doubling malaria cases would take us back to a global death toll we haven't seen for 20 years. We cannot let that happen. We must act to mitigate that impact and ensure that we continue to make progress in defeating malaria, leaving no one behind. The Global Fund has already taken such action. We have made up to $1 billion available on top of existing grant spend to help countries mitigate the impact on existing HIV, TB, and malaria programs, to help them respond to COVID itself with diagnostics and PPE, protecting health workers, fixing gaps and weaknesses in health systems. But we need every partner to step up to this crisis. And you, the private sector, have so much to offer. Whether it's expertise in supply chain or in changing behavior and communications or in the digital side of health delivery. These are key, critical aspects, areas in which you can help. This is a crisis that could see us set back the fight against malaria by many years, or if we rise to the challenge and act together, it could be an opportunity for us to redouble and actually accelerate the progress we're making in fighting this disease. I hope that together we rise to this challenge and not only beat COVID, but also mitigate the impact on malaria and turn it round so that we, in fact, accelerate our progress in beating this disease and leaving no one behind.
Really, really great to have that message from Peter. Win-Win, I'm going to go to you next, but just before I do, I want to do a quick pulse check. We've now heard from all of these interesting people who have got private sector, public sector, multilateral commitments to ending malaria by 2030. I want to just see how this audience is reacting to the feasibility of that challenge. Sonia, we've got a poll question that asks about the possibility of eliminating malaria in the greater Mekong subregion and Indonesia by 2030. Would love to have, we've got a significant critical mass on the call here. If you would vote, let us know if you think that this is, you agree that it is possible, you disagree, you think it's a long shot, or you're not sure. We'd love just to have your quick reactions to this. And we'll keep the poll open here as we gather up a few more responses. Maybe just another 10 seconds or so. Lots of, from what I'm seeing, lots of positivity on the call, which is great to see. A few people, sort of unsure or a little bit less hopeful, but let's end the polling there. Maybe we can share the results, Sonia. So again, I think hopefully for those on the screen today, this is very reassuring, right? Lots of people believe, almost 75%, almost 3/4 of the group here believe that it is possible to eradicate malaria by 2030. Win-Win, I'm going to go to you now, as I promised. You are at the helm of the largest grocery retailer in Myanmar. You serve millions of customers, so you are client-facing every day. Peter, who we just heard from at the Global Fund, said in a recent article, quote, "Most major companies have a strategy for mitigating the impact from climate change and environmental risk, but few, if any, have articulated strategies on how to improve global health." Now that we've had this massive COVID-19 pandemic upend our world, do you think that's going to change? And if so, how do you see that changing? Oh, Win-Win, you're on mute. It's the 2020 phrase of the year. You're on mute. You're still on mute, Win-Win.
Yeah.
Thanks for coming in.
Thanks for the reminder. Thanks for coming in. Yeah. Okay. So good afternoon, everyone. I'm from Yangon. So it's my pleasure to join this panel. So we started working with M2030, I think 1.5 years ago, and we because malaria has been a serious issue in Myanmar since a long time ago, and I have personally I have relatives and friends who were victims of malaria. So when we got the opportunity to partner with M2030, we were delighted of that opportunity, and we did very successful campaign to raise awareness and funding to fight against malaria, and we were very pleased with that result. And that was before COVID, and we hope to continue that momentum. And I think if I go back to your what Peter mentioned to your phrase, I think I guess we have underestimated the impact of global health crisis before COVID. We did so for our retail sector, we did a strategy review for our 2025 plan, and we did like a few rounds of a few series of dialogue with internet and external stakeholders to see where the priorities that they would like us to focus on to include in our business strategy, and most of the stakeholders' concerns are on like climate change or environmental impact, and I would say the health crisis was not a priority. But I guess with the COVID, the whole scenario has changed, and everyone realized that I mean, when such crisis impact us, it is more than health crisis, right? It is impacting social, economic, I mean, it comes along with other social and economic impacts. So I think so that really I mean waking up all the policymakers and the stakeholders. So I would say COVID has been a food retailer in the country. COVID impact. I mean, we got we faced with a few I would say a few interesting challenges. So on the first round, there was like pump up demand from very high panic buying demand for food items, and also supply chains got chaotic because of the lockdowns and the restrictions, and so we have to manage those challenges with the with the assurance that all our employees and consumers coming to the stores are safe. So we have like over 100,000 of customers coming to the stores every day, and we need to really make sure that we have safe working environment for our employees as well as those consumers. And that was like very so we need we need collective effort. I mean, our team effort to get past that stage, and so yeah. So that was I would say so I would say that so after successfully Myanmar compared to other countries, I think impact of COVID. I mean, COVID control has been, I would say, compared to other countries, we have been doing well because the infection rates are quite low, but having said that, we we are aware that the economic impact has not been has been severely impacted like other countries. So, and with that, consumers, I mean, we also see after first wave of COVID, consumer demands have been changing, and consumer response to the COVID crisis has been very interesting. So we see that there be fundamental changes in the behaviors, like there's growing demands on health care and health related products. There's growing demand on local products. There is growing growing demand on more on online shopping. So we will need to take in those we have to reflect on those changes and reflect them in our future strategies, because we know that these changes are going to be permanent, and these are becoming our new normal situations.
Absolutely, absolutely. Well, Win-Win, thanks for that. It's, really valuable to hear from you. And I'm going to maintain this fast and furious pace, because we've got such a significant cast of speakers here on the call. Dr. Witt, I want to turn to you next. Dr. Witt, you are the director of the Danin Tawi Shrevenant Foundation. I think that is a name that needs almost no introduction, but the foundation bears the name of one of the most influential and prominent business leaders in Asia, if not the world. And my understanding is that this is specifically an initiative of the Kundanin Shrevenant Family Office, with a specific focus on access of quality of healthcare to the underprivileged. You've made major commitments, including a recent $2 million commitment to the Global Fund, which was well covered. And I'm absolutely positive additional commitments to the effort to eliminate malaria in the greater Mekong subregion. Can you tell us, though, a little bit about the foundation, its mandate, and of course, how you're responding to malaria, but I know that you've also taken some measures to help provide a response to the COVID crisis. Tell us a little bit about your work, if you would. We can't hear you, Dr. Witt. I'm not sure. It looks like you're not on mute. I'll just give you a moment here.
Okay. Can you hear me now?
I can hear you loud and clear now. Thank you.
All right. Okay. Thank you, Joshua, and thanks. And then it's my pleasure to be here with friends, partners, and all the like-minded people who care for others. And then, as Joshua has mentioned and introduced briefly about our foundation, we are a non-profit organization who really
We're having a little bit of an inconsistent connection here, Dr. Witt. What I'm going to suggest, are you with us? Can you hear me?
Yes. Sorry about that.
Please, go ahead.
Yeah, it's my fault. Okay, I will be brief. Okay, so our foundation focuses on helping the underprivileged and the vulnerable in the society. So with the focus first on domestic group, which is in Thailand, and we believe that to enable our lives to have a more equitable and then more resilient, we need to focus on two things: education and healthcare. And healthcare is one component that we see that we can play some role here, especially to supplement the healthcare system by the government and by the global communities. So that's why it brings us to be involved, take part in the Right to E program by the Global Fund in 2018, where we see that our target groups, which is vulnerable people and underprivileged people who live very far away in the rural areas, and those people are the most affected by the diseases like malaria and other like tuberculosis. So that's why we see that the partnership with the Global Fund would bring a lot of opportunity to those people in Thailand. And then this comes to the end of this program, because it start in 2018 and it will end in 2020, which is this year. So we think about how to continue our partnership and our activities on the ground. And that's why that brings us to another partnership with the M2030 with APMA to start the initiative in Thailand. And with that, we started off by the end of 2018 and beginning of 2019 and run until now, which is continues to explore ways to engage business communities and other sectors in Thailand to be involved and be part of the initiatives to eliminate malaria from this region. By understanding that there's a close connection amongst the neighboring countries in Southeast Asia, that the success has to lie on each of individual country to also be part of the big collaboration. So that's why we take part in Thailand. We think that if we can bring Thailand to have a significant contribution for the region, that would also help in the overall picture. So that's how we involve in M2030 as well. And as part of being experienced the pandemic COVID-19 in the outbreak in the region, I'm a believer of the opportunity and see that this kind of crisis bring a lot of opportunity. Definitely, it brings out some threats and some challenges to the health community. But at the same time, I would believe that it also leads to some kind of opportunity if we can see that. So we have to really think more carefully how we're going to bring a positive side of the COVID-19. For example, nowadays, wearing masks seems to be a common measure for the people in the society. And one of the philosophy behind wearing masks is not about protecting yourself, but protecting others from getting infected. And that is a kind of mindset that we would like people in the society to have in fighting against any diseases, not COVID-19, malaria, and other diseases also. So it kind of level up people awareness and people right attitude of people towards healthcare, better protection for the healthcare system. So this is a long way to go for us anyway. Learning from COVID-19 will bring us to a new measures that we're going to work with domestic partner as well as international partner in the future. Right. And I think I will stop for now, Joshua.
Brilliant. Thank you, Dr. Witt. We are now into my favorite portion of these things, which is the Q&A with the audience. We've had a few great questions come in here through the Q&A. If others have additional questions, please feel free to share them in the Q&A function, and we'll try to get to as many as we can. I'm going to exercise my superpower of being the moderator and choose the ones that I like best. And the first one I want to take, and I'm going to direct it at the M2030 champions, is really this question of how do we motivate other businesses? This group is clearly very motivated, and you've made personal commitments, financial, otherwise, commitments to raising awareness, raising funds. I know that you have outsized influence on your peers. I see it in Davos. When you come to Davos and you say, we are committed to this issue, it has an impact on others. How do you as business leaders and leaders in your communities commit others to this effort? Sorry, and if anyone who would like to take that can take it, but Melvin, I mean, will you take a first crack at it? Can I put you on the spot?
Sure. You know, I think, and there was also a question about raising awareness too. I see the M2030 initiative. A lot of it is really about continuing to put pressure on a discussion and awareness on the topic. I mean, there is a reason why the cases of malaria has dropped so much over the last couple of decades, and it is to do with the good work by many people. The global fund being one, but also the public sector. Particularly if you look at Myanmar, where I'm based, I think the government and the public policies have done a great job in really driving awareness, whether it's just mosquito nets, etc. So the risk that I see is really that pressure coming off, and then people start moving on to the other topics and thinking that this is already defeated. Because just like COVID, I think you're seeing in certain countries, the second, third, or other waves coming as soon as people let the guard down. So I see that right now there's an opportunity for us to really raise this as a discussion topic, that we are near the end, but that doesn't that's not enough. We need to get to the end. Now, how do we really raise the awareness? You know, we can talk about it. We do a number of fundraising exercise. And in some ways, you know, it would be great to actually get some funding to support some of the initiatives. But I also see that as a way to engage in a conversation about why this is important, whether people really contribute money or not. At least that is a discussion topic. So, you know, having these M2030 boxes, you know, in all the city marts that women own, in the supermarkets, and also in our rural areas when we do money transfer, etc. You know, it's all a part of the effort to make sure that this is not forgotten.
Thanks, Melvin. Would any other panelists like to come in on that?
Yeah, if I may. I think we have to acknowledge that each individual has a role to play in malaria elimination. So, and those roles can be different. So there's no one size fits all for everything. So it means that we must have choices for the business communities to choose how they're going to contribute to elimination. So it's not just donation, as Marvin said. It's not just as donation. It can be other sorts of in-kind contribution. It can be sort of other things. So we need to have them choices.
Choices, yeah. Maybe I can swing the spotlight around a bit back on the M2030 team. We have Patrick and Ruby on here, and I just want to answer this question in the chat box, I believe, from a Michael McDonald. I think it's a great question. The question is, in addition to sustaining the strategy that's been set, is there a need to pivot? Given COVID, do we need new strategies, or is this a case of stay the course? Ruby or Patrick, feel free to take that.
Sorry, I just had trouble unmuting. I think we definitely need new strategies. I think that the reality of this world today is that this is not going to be the last pandemic. I've heard other eminent, experts in the field talk about how we're going to continue to have other pandemics. And so, the world is getting very crowded. There are lots of animals and markets, and people are, commingling with all these different animals plus human beings, and closer and closer living together. And so I think that it is true that this is not the last pandemic. And so I definitely think that we're in for a completely revamping, rethinking, rebooting of what we know as the new normal.
Thanks, Ruby. We are running dangerously short on time, and I want to leave a few minutes towards the end here for Patrick to sort of take us home. If we could do a very quick tour of the table, sort of tweet length responses, 144 characters in a breath, what would be your one message you'd like the viewership of this webinar to leave with? Win-Win, maybe I'll start with you in a breath. What do you think is the most important message you want to leave people with? You're on mute.
Yeah, I do a short one. So I really think that we need everyone have to join in to win against these pandemics.
Thanks, Win-Win. Juliana, maybe over to you. What would be your one thing to leave people with?
Yeah, I think we need to join together, to work together, even in the business sector, private sector, or government, and everyone, CSR, to work together to fight this malaria, and we will eradicate all this malaria by 2030.
Brilliant, thank you, Dr. Witt. Last final thought.
Just keep safe and strong so that you can help others more.
That's right. Melvin.
Yeah, I want to say that I think businesses, private sector have to have a much more expansive view of their responsibility going forward. COVID is a wake-up call to all of us that our responsibility expands beyond business and profit making. Public health being one, but there are also other responsibility in the community that we need to be wary of.
Brilliant. Well, look, I'm sorry that there's a number of Q&A questions now pouring in. I'm afraid we weren't able to get to all of them. There will be a follow-up email to everyone who registered with the details for Clint at Aploma M2030. But Patrick, I'll just pass the mic to you for the final word. Maybe you can take us home.
Thanks, Joshua. First of all, I'd like to thank all the M2030 champions for taking the time. Melvin, Juliana, Win-Win, and Dr. Witt for also sharing their views and their perspectives. I also want to thank everyone who dialed in. Yeah, so how to summarize this? I think it's almost impossible to summarize these rich conversations in 30 seconds. Is that what we have? And luckily I don't have to, given that we actually have a recording of this webinar, so everyone can go back and check it out later on and listen to it again. Having said that, I think there are a few things that sort of stand out. One, of course, is we're facing this huge crisis with COVID-19, and the pandemic is devastating in itself. But if it also disrupts other critical health services like malaria or other communicable diseases, then the impact from COVID-19 will be redoubled. So we can't take our eyes from these other killer diseases. And I think that was a message that came out pretty strongly. The second thing is that to end malaria and to fight COVID, we need all hands on deck. We need governments, we need businesses, we need individuals, we need civil society. And that's why this leadership from the M2030 businesses is so important. And it's really heartening, I think, for us to see that M2030 businesses are now focusing on both malaria and COVID. It's not sort of it's not a choice of either or. It's doing both, essentially. And the third thing, my sort of tweet way of sort of saying what is really important, partnerships. Partnerships are critical for resolving almost any global development challenge. We need to do so effectively, I think we need partnership platforms to really harness that power. And M2030, of course, is one of those platforms. And we're always open to more partners if there are people out there who want to contribute. But of course, there are many other ways to engage in global health and development issues. And we hope that this has been inspiring for everyone watching. So I will end here to thank you again for joining. And yeah, over to you again, Joshua.
Thanks so much, Patrick. Only to say thank you to everyone. Stay strong, stay safe, and let's keep an eye on 2030. Have a great day.
Bye.